Domain 1 is expose and evaluate, which is weighted at 26%. You can see it's broken down even further into subcategories just to help really focus you in on what it is you need to know. So A is assessment and preparation. This is going to be questions about how do you prepare the patient for the radiographic exposure. It's going to ask you questions about selecting your radiographic technique. What's the purpose of the different types of films? And those films include periapical, bite wing, occlusal films, panoramic, cephalometric, cone beam CT scans. As we dive into this course, we'll break each of those films down. You will understand what they mean, what they are used for, what's the advantages, what's the disadvantages. Each one you can select for a different purpose. There are different conditions you may be able to view, different teeth, different landmarks, different reasons why we would take a periapical versus a panoramic. C says describe technique modifications based on anatomical variations and clinical considerations. Basically, what this means is that not every mouth is going to be the same. You need to understand how to take an x-ray on somebody that may not have a normal anatomic mouth. So, for example, taking an x-ray on somebody who is missing all of their lower molars versus taking an x-ray on somebody who has all of their lower molars. There may be a bit of modification that needs to be done to accommodate the patient missing their lower molars. It will ask you questions on how to select different equipment, different accessories that are available, different sized films. It will want you to understand why we may use one size film versus another. And again, all of this will be explained as we continue to dive into this course. Section B is acquire. How do we acquire radiographic images using all the different techniques that you will learn about? You will need to define the different concepts on radiographic exposure. You will need to know specifics on intraoral films versus extraoral films. What factors will influence the quality of that film? Demonstrate basic knowledge of digital radiography. Digital radiography is here to stay. It's not something that's going anywhere. In fact, it's growing more and more as technology advances. More offices are switching to digital radiography, and it's just exploding as technology does, and it's becoming the way of the future, or it is the future as of now. 3 is demonstrate basic knowledge of conventional film processing. So this is involving all of the different processing solutions, which are chemicals. This is your traditional film, and you will need to understand how we take care of those chemicals, how we take care of those solutions, and how they are changed and how they are used. C is evaluate. Evaluate the radiographic image for diagnostic value. Does it look good? Can you see any errors? How would we correct those errors if you have found an error? Are there any errors with processing the film? How do we correct improper handling of the film? 2 is mount radiographic images. So it will ask you questions on how do you mount using the facial view. It will ask questions on the anatomical landmarks. Anatomical landmarks are important when you're mounting. It will help you find the orientation of the film. B is identify anatomical structures and dental materials observed on radiographic images. So what's radiolucent, what's radiopaque? Basically, what is light, what is dark, what is bright, what is not so bright. Different things will appear differently on the image. D is patient management. What techniques can be used for patient management before, during, and after radiographic exposure? How do we handle patients with special needs? How do we handle patients that may have a severe gag reflex?